Welcome to the Care Economy pitch session. My name is Aditi. I am the Economic Prosperity Community Lead, and I'm joined by my colleague, Ileana Fromm. She's the Economic Prosperity Community Officer. We're so excited today to have you meet some incredible innovators working in the care economy and to give you a chance to get to know them better. But first, just a little bit about how we got here. So earlier this year, we asked the question, how can we make giving and receiving care accessible, affordable, and valued for all? We looked for solutions that enable new models of care, that increase access to trainings and certifications, that ensure decent working conditions for care workers, and that establish care working as a broadly respected profession, ultimately hoping to reduce stereotypes around gender. It is a beautiful day out, I agree. And it's a beautiful day to be here. So we asked this question, we were looking for solutions from all around the world, and we put out this call in February. In less than 60 days, we received over 160 solutions from 46 unique countries. We worked with Solve members, with the MIT community, and a phenomenal leadership group to select 15 finalists. The leadership group interviewed each of these 15 finalists and selected the 8 teams that are here with us today. A little bit about our cohort. 50% are nonprofit teams, 50% are for-profit or hybrid. They represent 6 countries, and they span in stage from pilot to prototype to one company looking to scale as well. So, I want to take a second to thank our incredible judging panel. They've been instrumental and spent a lot of time in selecting our 8 solver teams, and will be championing their work in the coming months as well. Yeah. Challenge leaders, would you like to wave to be recognized? Just let people know who you are. Do you want to do a little wave? Yes. Yay. Great. So now, I'm going to bring on each of our 8 teams to do a 3-minute pitch so you can get to know them a little bit better. Please remember that you can follow them on Brella and hold your questions. You'll also have a chance to meet with them right after this. And yeah, without further ado, I am very happy to bring on our first team, Karina Care Matching Platform, presented by Nidhi Mirani.
Hi, everyone. All right. I'm Nidhi Mirani. I'm the Executive Director of Karina. We are a nonprofit care matching platform. As you all know, the demand for care is increasing worldwide. You can't read a newspaper or hear a headline about it without a day going by. At the same time, there's little increase in care providers. It's a drip, not a flood. Care providers, though, because of access to full-time work and enrollment in their services, are leaving. And so all of this is where Karina is working. I wish I had a really moving founding story to bring you to tears. I do not. Instead, this is not my epiphany or my idea. Instead, it was tens of thousands of home care workers who took collective action and made a demand across a bargaining table to a real solution facing their access to full-time work. And because of that demand, our solution, Karina, exists. I hope this looks deceptively simple. And you're like, wait, shouldn't there be a lot more on that screen? But that is the point. Anyone who's built a 2-sided marketplace knows that the answer is in simplicity. And related to that, building supply and demand, chicken and egg, all that stuff, in addition to fostering great quality interactions. We do that in so many ways with our solution. Care workers never have to log back in. They update all their information via SMS. We display travel time, not only by car, but by public transport, and never reveal anyone's address. We have built so many features to address harassment, abuse, and discrimination. It's literally hundreds of solutions to hundreds of challenges that are part of our solution. And even then, anyone who's also done this work can tell you that's not enough. There is no build it and they will come. Absolutely does not happen, right? So your marketing, your distribution strategy are core. For us, that means working in partnership. We work with institutions that are in it for the long run. They've spent decades and decades committed to their communities, and this helps us get it into the hands of those who need it the most. These two things, accountable technology and working in partnership, have resulted in an effective multi-state solution. We've made over 10,000 care matches to date and generated $80 million in earnings for care workers. But it's best said in Glenda's words. Jeanette hired me on the spot. She also has a son who has hours, so I'll be working with him too. Between the two of them, I have full-time hours. Not to mention, they live less than a mile from me. Blessed. And so where I'm here today, because we're ready to increase our impact. We want to do more with our data, focus on our network effect, and really scale for impact. We have stable funding from our program revenues. However, those revenues cannot be used to do this work. And so what we're looking for is innovation partners, expertise, and funders who want to work on these things. We're a diverse and dedicated team. Our engineering team has been with us from the start, from 2016 in Seattle. I can guarantee you they've tried to be recruited away, but they've been with us through the beginning. We're excited to answer the question, what a technology accountable to care workers and their communities can achieve. Thank you.
Thank you so much, Nidhi. Next up is Paul Spillman with Care Exchange.
Is this working? Hi, everybody. So I'm Paul Spillman, co-founder of Care Exchange, and this is about one of our products we have out, which is called Staff Share. And what I'm going to go through quickly today is how we get these three entities to work together, because currently where we see that there is a slight disconnect. I'll get this right in a minute. So first entity is Mr. and Mrs. Smith. These represent people who require care or assessments or anything. Currently in the UK, there's over 500,000 that are stuck waiting for this. That means they're blocking hospital beds or they can't get care in their home. What Staff Share does is reduces these waiting times, and it's about utilising the current workers that are out there. And there's a second part to it as well. We also look to help care workers earn more money, in terms they are usually in silos, so they don't actually know that there's extra work they could do. Mrs. Thompson. So Mrs. Thompson is a typical care worker. A lot of care workers are underemployed, which is why we've looked at staff sharing, because again, they're in silos. They may be working on their own. They may be working for an agency, which is only one part of what's happening in the local place. And again, staff share looks at taking away the blockers that stops Mrs. Thompson finding more work. The bad guys, not necessarily the bad guys. I think the employers or the agencies out there, they're posted as the bad guys, but I don't think they see an alternative. What's happening is they're head down trying to cover all the work that's coming in from the local authorities, and they don't know what to do with it. Staff Share again gives them that alternative. We are working currently with 2 local authorities in the UK, one of them where we add all the providers in an area, they add all their workers they have, and they start to share what hours are available so other people can tap into it. So you start to utilise what's happening. That does 2 things: they get better utilisation, and the other thing is care workers earn more money. It's all about collaboration. What we found with Sunderland City Council, which is a city council we're working with, is care is about community and everything else. Our platform creates that because the providers start to talk to each other rather than ignoring each other. The care workers, who sometimes are on their own, they don't even work for an agency, get support from us because we provide support for HR and training, and that builds that community that's in care. Our team, we've been accused of being cavemen. At one point, one council court said we were heretics in what we were trying to suggest, but we've been successful because we understand it from a personal level. All of our team have been involved in some way in care and how it affects people. We're also lucky that we build our own technology because a lot of us have got that skill set. So what are we after? Quite a bit. we're at that stage where we need to expand. We're looking for mentors, people to help us fill in the skill gaps that we haven't got. We're also looking for connections with councils, regulators, or government that the same that covers care. And we're looking to raise $600,000 funds to enable us to grow from a regional, what we are now, to a national business, and then to spread internationally. Thank you.
Thank you so much, Paul.
Good afternoon, everyone. So pregnancy is not a disease state, and no woman should die bringing life into this world. Let me introduce you to Mrs. C, one of the beneficiaries of the work we're doing in Sub-Saharan Africa. So before we got to Mrs. C, she was anemic, and she had not had any pregnancy scan done, putting herself and her baby at risk of preventable pregnancy complications. This problem is faced by over 30 million mothers in Sub-Saharan Africa annually. And of the 810 mothers who die daily in the world, 2/3 are in Sub-Saharan Africa. This is completely unacceptable. Our solution is a health platform that works with a network of community healthcare workers that we empower with point-of-care technology that allows us to identify high-risk mothers in communities for early referrals and quick intervention. How this works, we identify a community healthcare worker, upskill them, or we talk to a partner who provide us with a community healthcare worker, then we're able to provide them with a kit they need for last mile health provision services. And with this, we're able to identify high-risk mothers in communities. But on top of that, the mother is still able to get tailored health support according to the age of the pregnancy she's at, via text, audio, video, including pre-recorded sign languages. So over the last 2 years, we've been running our pilot. We've supported over 4,000 mothers. And in the last 3 months, we've had 684 signups. We've done 93 home visits, and we've been able to assist self-delivery of 10 healthy babies. In the pipeline, we already have 5,000 patients through our partners, and we have a reserve of 65 community healthcare workers. Our competitive edge is that we're providing a platform that essentially empower community healthcare workers to provide last mile health services, but we also have a multilingual system that enable mothers to get comprehensive support in the language they totally understand. And we're also able to essentially provide a point of care that enable us to identify high-risk mothers in time for quick referrals. This is my superstar team, and together we have over 30 years combined experience in clinical medicine, software development, health economics, and finance. And we're already getting support from the likes of Africa Oxford Initiative, Artificial Intelligence Development for Africa, and ViewGrow. Currently, we're operating in Zambia, scaling into Zimbabwe, and we're planning to scale into the neighboring countries in the next 24 months. Then after that, target the rest of the African continent, then other low-income communities. So what we're asking for, we're looking for legal expertise to help us maneuver this highly regulated space as we scale across different emerging markets. We're looking for mentorship and partners that will help us build strategic scaling goals into different markets. And finally, we're looking for financing as we start expanding our operations into the markets we're targeting. So if you're passionate about putting a dent in SDG number 3, 8, and 10, Dawa Mom is the perfect partner. Thank you.
Thank you so much, Tafadwa. Next up is Ronald with Dessence.
said is that at least 7 million Ugandans have internet. 75% of kids and very few achieve the secondary level. 80% were working. So we are trying to change this to bring a paradigm shift by introducing the power of assistive technology. We have created a web and mobile phone-based application to connect persons with disabilities to people who are trained and who have experience in providing care support. We have made steady progress. We launched our MVP and we were able to get wonderful feedback, which we are using now to improve the platform more. We also trained over 70 support specialists and onboarded them on the platform. I'm happy to inform you that so far we have 200 users accessing the platform. Data is also ranked in top 10 most impactful companies during the 5th State World competition supported by Ideas Boundary. This is a wonderful team. Volunteer team, by the way. It is very diverse in terms of gender, disability, but also expertise. Ladies and gentlemen, we need your support. We are looking for $160,000 to support us in operations, recruitment, and marketing. But also, we need inside support. As we realize, we are very young and we need to grow to address this challenge, not only in Uganda, but across Africa. Thank you very much.
Thank you so much, Ronald. Next up is Zinat Ibrahim with Jami Life.
Jami Life is inspired by my grandmother. My grandmother was bedridden for 16 years. She suffered several strokes, heart attacks, had complications from diabetes, breast cancer. My cousin, who's 3 years older than I am, stayed home to be her primary caregiver. This is the story of 60% of South African families who have no solution, leaving family members, often women, to stay home and remain out of the workforce. Jami Life is the solution I wish we had when my grandmother was still alive. We uplift Black and colored health workers and family caregivers with tools, training, to deliver high-quality home care to those unable to access or afford it, transforming them into valued members of the workforce. Specifically, we do 3 things. We family care that they're able to provide in homes, and support them through accreditation if they want to earn an income, because everybody needs money. We have our own team of amazing health workers. They're vetted, they're expertly trained, and they provide care irrespective of whether patients can pay or not. And we track health vitals and emotional well-being daily, play that back to family members, to doctors, to caregivers, to facilitate care coordination and monitor progress so we can try to avert risks in the future. We envision a world where vetted care, training, technology is available for all communities. We have an amazing team between the 5 of us, plus, well, just this 5, there's at least 60 years of nursing, rehabilitation, and caregiving experience, and a team of health workers. But we need our technology and data solution to be better, to improve the ability for caregivers to more easily input information, and for families and doctors to access and to improve accuracy. And so we're looking for mentorship, hands on deck, help with strategy and technology and data planning, and we need fundraising to continue to support those who are not able to pay for caregiving service for free. We are really excited to be in community with this amazing cohort of 7 other organizations, and grateful for each of you that have joined us here today. It's really me to think about the fact that each of us will experience this challenge as a care provider or maybe even need care ourselves. And so grateful that you chose to spend the time with us today. We'd love you to follow our journey on social media, reach out, stay connected. And I'm really excited about what we can do through collective effort with this group and others. Thank you.
Thank you, Zena. Now we have Alex Dai with Kidogo.
Hello, everyone. Nice to be with you this afternoon. Globally, 350 million children lack access to quality childcare. It's a childcare crisis. This crisis is really felt by poor working families in Kenya, where Kidogo works. Imagine, for a moment, that you are a working mother living in the urban slum of Nairobi. Every day you make a devastating decision on where to leave your 1-year-old baby daughter. You tie her up to furniture at home and leave her alone for the day. You pull your older daughter out of school and have her stay home with your baby. You leave your baby in an informal daycare where an untrained caregiver provides limited supervision for 12 hours a day. This decision has huge consequences. If a baby spends their essentially early years in an unsafe, unstimulating environment, they have physical, cognitive, and emotional deficits for life. At Kidogo, we are building a world where every child has access to quality, affordable care and education. The typical informal care center in Kenya is dirty, unsafe, and unstimulating. There are also no opportunities for care workers to grow their business. Our proprietary approach is a much-needed, high-quality, and affordable childcare option for parents living in the urban settlements. This Kidogo way uses ECD global best practices. We provide safe, stimulating environments with nurturing caregivers, play-based activities, health programming, and we have ongoing business training for care workers. We use an innovative Kidogo social franchising solution where we partner with entrepreneurial care workers, who we call mamapreneurs. We provide them with training, mentorship, and ongoing support to improve quality in their childcare centers and ongoing business training to grow a profitable childcare business as a branded Kidogo franchise. We also supplement our grant income through earned revenue from franchise fees, and we are creating a vibrant and sustainable local care economy. We are currently the largest childcare network in Kenya. Every day, we impact 16,000 kids and their families. We're on track to reach 100,000 kids by 2030 and have been doubling our reach every year while decreasing costs. Over 3 years, we reduced our cost per child by 79%, and we're ready to scale across other regions in East Africa while growing partnerships to further accelerate scale and decrease costs. We have a profound impact on 3 groups. 80% of Kidogo kids are development on track, and through nutrition programming, we've decreased stunting and wasting. Care workers have a 2.5 increase in income after 1 year of joining Kidogo, and our Kidogo moms have 100% decrease in stress, enabling them to work with peace of mind. We have the right team on the ground to solve the childcare crisis in East Africa. 90% Kenyan, 80% women, many from the communities that we serve. We're looking for folks working on gender, ECD, and advocacy. We're seeking advice on scaling opportunities, and we're looking for new funding partners to help us raise $10 million in grants over the next 3 years. Thank you so much, and thank you for joining us in improving quality care.
Hi everyone, I'm Rebecca Karasik, and I grew up receiving traditional child care from family members and friends, and I saw just how undervalued care workers are in our society. They're doing some of the most important work in the world, and yet they're earning poverty wages. So I co-founded Pie for Providers, which is a US-based nonprofit, to help change that. The problem is that a lot of money is there on the table. Government funding does exist that could boost providers' pay, but the rules are too complex, the system is punitive and stressful, and requires time that childcare providers just don't have. And on average, childcare providers are earning around $24,000 a year. And when they're leaving thousands of dollars on the table from this, that's a huge portion of their income. Our solution helps childcare providers claim more government funding in a way that's respectful of their time and expertise. We call it the TurboTax for childcare, and it's the only solution out there that's maximizing providers' revenue via government funding. To understand how it works, take Ashley. Ashley is one of our users, and she's a home-based childcare provider. We help Ashley in 3 main ways. First, we help Ashley claim more money by making sure she doesn't miss important revenue opportunities like getting bonuses for working extra long days. We also alert her to other revenue opportunities throughout the month so that she can take action early. Second, we reduce Ashley's uncertainty. Before using Pi, she was stressed every single month, not knowing if she'd be able to pay her bills. Now she knows exactly how much money to expect from the state, giving her more control and more transparency over her business. And third, we save Ashley time by eliminating the manual and burdensome monthly billing process. We provide Ashley all of the calculations that she needs in the state's required format, saving her many, many hours every single month. Our team has a lot of experience in tech for good and startups, as well as lived experience with the child care crisis, and we also have deep relationships in the early childhood space. And since our launch last year, we've already had a lot of impact. 89% of our users claim that they get every dollar from the childcare subsidy, which is the main government funding stream for childcare, by using Pi for Providers. And today, 65 childcare businesses are managing almost $2 million on our platform for 300 children that are accessing quality childcare. But we need your help. We need your help to scale nationally. We aim to claim 40 million net new dollars every single year for over 10,000 childcare providers across the country. And you can help us by promoting our work. We distribute our product primarily through partners like government agencies, unions, and nonprofits. So if you are in one of those groups or you know folks in those groups, we would love to get connected and talk to you. We need help connecting us with tech and product talent. So as we scale, we can build a scalable and robust platform. And we're looking for philanthropic funding with organizations that are focused on economic justice and early childhood. So we all know, but supporting childcare providers means supporting our local communities. And when childcare providers thrive, we all thrive. So thank you.
Hello, everyone. My name is Ashley Barrow. I'm the founder and CEO of Reassist. I have over 16 years in transfer of care planning in addition to having a family member have a crisis. So very connected to the space. And today I just want you all to rethink transfer of care. Meet Joe. Joe's had a stroke. He's in the hospital. He needs to transition from the hospital to the acute care, from the hospital to a skilled nursing facility. He has provided this paper choice list. And this looks nice, guys. This one is in color. It's copied neatly. It's probably got right people on there. Like, this is a nice one. But this is what he's given in his time of crisis, where he needs to go to the next level of care for his recovery. He's working with a case manager who's kind of a little disconnected. She knows a lot about the institutionalized resources, but the resources outside the hospital, she's educated also on a paperless directory. Medical sales reps come into the hospital and educating her on their services and word of mouth. This is 2022, guys, where we're looking at transfer of care, someone's health here. But she's looking at affordability, bed availability for the patient, the family influence, services, locations, and also resources is a factor for her. So with this, it's insufficient. We found that this is the most confusing multi-layered part of the discharge planning and the care planning process. And it relates to about 20 to 30% of individuals like Joe readmitting to the hospital within 30 days. It's a $41.3 billion problem. And there's really no real industry knowledge out there but the paperless directory. So that's where we come in place with Reassist. Reassist is a patient-facing digital health platform that replaces that paperless directory in care planning. And here's how we work. We work with healthcare entities to vet and fact-find services. Once that's completed, service providers are able to access our platform and use us like a marketplace for admission, where they can manipulate information such as insurances accepted, on-site services, hours of operation, forms that's needed, and things for eligibility. Then patients and then also service providers can access our platform as a knowledge tool and have things that they need pop up within seconds. We need your guys' help to get to our next phases. We are looking for integration, EHR integration, electronic health record. So we have patients chart right within our platform, cost transparency and API integration for pre-certifications, rehabilitation care planning with messages for continuity of care between the service provider, the patient, and also the case manager. We have a multi-generational team ready to take on this challenge, diverse in nursing, software development, engineering, and project management. We need your help to disrupt the transfer of care planning process by getting us connected to a marketing campaign that can tell a story of how a family crisis and COVID birthed Reassist, a platform that will save lives. An executive plan that can get us connected to people that thought leaders and subject matter experts that can help us with our organizational vision as well as projections. And finally, and most importantly, guys, we need funding to build out our next phases of development and add staff. What we like to do is deliver quality of life to patients and reduce the burden of care by working in hospitals, nonprofits, and home and community-based waiver programs. Let Reassist be the difference in your transfer of care planning. Thank you.
Amazing. Thank you so much, Ashley. And a huge thanks to all of our solvers. Can we get another round of applause for the entire team? Awesome. Thank you. So it's been a real pleasure to hear all of our solutions. And now I have an honor to present the Solve Community Award. So every year we invite the general public to vote on all the finalist solutions. This year we received over 17,000 votes, and the team with most votes in each challenge is awarded the Solve Community Award and $2,000. So I'm really glad to announce that our winner for the Care Economy Challenge is Dozens. So, Ronald, would you like to come up here for a photo? Take a photo up here. Thank you. Awesome. I'm also very excited to present this next award. This is Johnson & Johnson Impact Ventures Fund. They have a few words that they've asked us to share here. They're a fund within the Johnson & Johnson Foundation that deploys investments in healthcare innovations that address health workforce and healthcare challenges in low-income and diverse communities. Because of this focus, J&J Impact Ventures collaborated with MIT Solve to support teams from our Equitable Health Systems Challenges and the Care Economy Challenge. In fact, they were so impressed with the teams that they increased the total prize amount from $112,000 to $175,000 across 5 teams. I'd like to invite a couple of people from Johnson & Johnson up here as we call out the winners.
It's just me, but you all are phenomenal. I'm excited to represent J&J today.
Awesome. I'm thrilled to announce that the three teams have been selected from the Care Economy Challenge as recipients of the Health Access Prize. So receiving $25,000 each is Care Exchange and Jamila. Also receiving $25,000 is Jamila. And receiving $50,000 is Dawa Mom.